the Mental Health Commission of Canada funded 14 community-based research projects to address knowledge gaps on the relationship between mental health and cannabis among priority populations. Each innovative research project was designed to meaningfully engage and ultimately benefit those directly affected by the issues explored. People with lived and living experience. The COVID-19 pandemic triggered severe social disruptions around the world, including in the communities where research was taking place. The impacts were far-reaching, and in many cases, research plans needed an entirely new way of thinking. Here is how some communities adjusted to the new reality. Dr. Rob Whitley.
So for this project, we applied for the funding from the Mental Health Commission of Canada in April 2020. And at that time, the horizon in front of us was bright and the sun was there and we were hopeful about the future. And then obviously this thing that many people thought would last a few weeks or a few months lasted 2 years, called COVID-19. Because of COVID, we had issues in terms of the public health regulations here in Quebec. We were not allowed to meet in person. The hospital that we're sitting in now was more or less closed down except for essential practice from the medical clinicians. So we had to think very quickly and basically pivot to an online project.
Megan Costa.
I think it's difficult to engage with participants in any sort of research, but especially with COVID, I know it's very repetitive and anyone will tell you COVID is it's a challenge in research, especially because we couldn't be there in person. And so I would say normally before the pandemic, as researchers, we would go in person and that way we could actually do a face-to-face interview. There were so many things we had to think about by doing interviews virtually as well. So for example, when you're meeting someone virtually, having their contact information, a lot of the time what we do is we don't know their names, we use client IDs. And the client IDs will protect their anonymity, confidentiality, but then we're doing these virtual interviews and I'm having to contact them, I know their name, I know information about them. Luckily it stays to the research team, it stayed to just myself and one other. But yeah, another thing is the video. Individuals don't want to be recorded, especially on video, when they're sharing and disclosing personal information.
Dr. Olivier Ferlat.
I think, the pandemic has really kind of changed the way we thought about research. Before we thought we really needed to be like in person to do interviews. It was a barrier for some people to kind of participate in the study. But also I think there was great opportunity for us to really mobilize, technology. So we're able to reach, people and they can do the interview in the comfort of their house and then they don't have to travel, so.
Erica Lemon.
For the actual research itself, it didn't have a huge impact because the peers were already going out on outreach and a lot of their stuff was outside. So a lot of the surveys were administered outside. The only thing that really started to impact was more maybe the interviews and journey mapping because there were some community organizations who were a little bit more hesitant about letting outside researchers in because of COVID protocols.
Terry Gillis.
Again, we had to sort of flip the format of everything because originally we wanted to incorporate gatherings, which is a very important part of the Métis community. Is to do in-person gatherings where where everybody gets together over a meal and shares with the community. And that was originally the idea, was every dialogue session of those 5 dialogue sessions that would happen from January to May. In the original plan, they would have happened in a different city. But because of COVID, it was all spent on Zoom.
One of the advantages of COVID is that we went to a 100% online project, which meant that we were able to interview people across Canada, which in fact we did. We interviewed people in Newfoundland, we interviewed people in BC, and everywhere in between, which actually opened up very interesting conversations and opened up doors that we would not have walked through if COVID would not have happened.
Thank you to the project teams who undertook their community-based research during a pandemic with creativity, compassion, and clever thinking to achieve their goals. For more information on the research projects, please visit mentalhealthcommission.ca. Mental Health Commission of Canada. mentalhealthcommission.ca. The views represented herein represent solely the views of the research teams. Production of this material was made possible through the MHCC's Cannabis and Mental Health Research Initiatives and a financial contribution from Health Canada.